Okay, so thank you for having me. This is my soapbox right here. How to properly check in a pet. Okay, and we have Pooh Bear. The Pooh Bear decides to be a little uncooperative. We do have a stuffed dog. Okay, so why do you want to take the time to check in a pet before you start grooming? All right, there's not a single thing you could do that will help prevent problems from even happening in your facility if by just doing a thorough check-in before you start grooming this pet. I will almost guarantee you that those pets that died at one of the corpse was they didn't check for gum color. If they would have checked for gum color, they would have known these pets were not healthy enough to groom. And pets that are not healthy enough to groom for whatever reason are more likely to have a heart attack, to have an issue on your table. And I have been in the position where I have had a pet die on my table. Okay. And that is a horrendous feeling. And I wouldn't want to wish that on anybody. Okay. And for those people who have taken my pet first aid class, you know this story. Okay. So Bingo, who was a 9-year-old Maltese who was cleared for grooming by his veterinarian, but had a heart attack on his table and died. If I knew now if I knew then what I knew now, I would have known to be checking gum color on that senior pet with a known heart condition, not only at check-in, but also throughout the groom. Okay, so to start with, to answer some questions, well, I don't have time. And I'm going to tell you, you do have time. My first time I do a check-in on a new dog, the owner is present. This takes literally all of 5 minutes to do. And in that 5-minute period, I can determine whether or not that this pet is healthy enough to groom. And I could have the owners acknowledge, written acknowledgement of any issues I find, that just so they do not come back to bite me in the butt. Also, I highly recommend having cameras in your facility. And I was mobile, and you could absolutely have a camera setup system in your mobile van as well. Okay. Stops that he said, she said, documents everything that you do. All right. So before I even begin putting my hands on a pet, especially a pet I don't know, all right, I'm going to first watch how this pet walks. Okay. Does the pet seem to be favoring a leg? Is the pet limping? Right? Is this pet looking lethargic? Okay. Because lethargy, a pet that's just kind of looking like worn out and tired, probably has something going on. All right. I have currently in my house, I have 4 dogs. I've had as many as 6. I don't want to bring anything home to the pets in my care either. Right. So if a pet appears lethargic, for me, that is reason enough to not groom a pet. I'm looking for discharge on the eyes. I'm looking for discharge from the nose. This is really important for cats, by the way, right? Because feline respiratory illnesses are highly contagious. Okay. So once we get past that whole, they seem to be walking fine, they don't appear lethargic, there's no discharge coming in. This is from the first time I'm going to put my hands on the pet. And we have Pooh Bear here. Okay, Pooh. So let's see if we can, or maybe we put Pooh Bear up a little higher. Okay, so here's Pooh Bear. All right. And the first time my hands go on this dog, it's back here. Because Bella would never bite you unless you were mean to her. But if Pooh were to rear around and nail me, I'm in this direction here, I can step back. Okay. So the first time my hands are on this pet is back here. I can put the camera down just a little lower. Ooh, hold on. Ooh, think we can do that. Maybe. Okay. So my hands are back here. And I am going to run my hands up the body. If this is a dog with coat, I'm going to have a comb with me. Okay. Because, they brush Bella every single day. And I'm going to note where the comb can't get through the coat, with, again, the owner presence. Because if this dog is matted and needs to be shaved down, the owner needs to see I cannot get a comb through this coat. All right. And then again, anything that I find is signed and wavered so that owner knows what to expect. So there's no miscommunication. Part of having the owner here is clear communication. I am not ever going to end a conversation with, I'll do my best. Because if a client hears, I'll do my best, what they hear is you're going to demat the dog. Whereas what you mean is this dog is going to be shaved down. Maybe I can get a 5 through the coat, maybe not. But there's going to be a difference in what they expect and what you tell them. I use the words naked. Your dog will be naked. Clear? Naked? You understand what naked is? I'll use that word throughout the assessment. So I'm going to come up here, and while I'm doing, I'm also going to be checking for any lumps or bumps, anything that I find is going to again be marked on a sheet. Barkley makes the check-in cards. Use them. All right. Don't do he said, she said with the vet either. Don't tell them. Mark it down. So if I'm telling this owner they need to get this checked out on the vet, I am not telling them. I am writing it down for them so that they can hand it to the vet. All right. So skin is also the largest organ in the body. So if there is any problem somewhere else, it may first manifest in poor quality coat. Poor quality coat could also be poor nutrition. Right. So I'm going to come up, and as I'm coming up the body, what I'm always paying attention to is body language. Okay. I'm looking for him for any kind of tensing. Right, this shoulder here hurts, and if I'm coming up over here, he may glance at it. His body may tense. Right. They know where it hurts. Right. Just like you know where it hurts. And for anyone here, I mean, we're all groomers. So we got various aches and pains. And I will guarantee you, if you have knee problem and someone is coming barreling towards you, you know you're going to protect that knee. They are the same way. They know where it hurts. All right, so I'm going to come up, again, watching body language. Pooh's a very good boy. And I'm going to come up here to the top of the head. Let's see. Up to the top of the head. Okay, I'm going to check his ears. Dogs that have hair on their ears, I am going to run my fingers along the ear leather. I'm looking for any sensitivity. And for dogs that have hairy ears, I am going to feeling for any kind of matting that might be a hematoma. And for those who don't know what a hematoma is, this is what happens. It's a blood vessel that fills up with blood because the matting is so tight on the ear, it constricts those blood vessels. So that when you remove the matting, that blood vessel can burst, and it can be quite messy. Okay. I'm going to look at the ears. Okay. Ears should be nice and pink. And here his ears are a little sort of pinkish gray, which is normal for him. If there's anything in the ear outside of what I would call normal dirt, okay, if it's black and gooky, if there's yellowish oozy stuff, I'm not cleaning this ear. I'm going to document it, and I'm going to put on the thing. The ear presents as, meaning I am not going to use the words ear looks infected. I am not a veterinarian, nor do I diagnose, but I'm going to describe the issue that I see, and I will tell the owners that I will clean the ears with vet clearance. Now, for those who can't do that, this is your business. You get to set the boundaries and your policies and your procedures. In the 20 plus years that I was grooming, I have never lost a client due to my policies and my procedures. Okay. So once the ears look good, I'm going to come along the face, feel down here along the snout, and here, look at the eyes. Eyes should be dilated the same. And I will tell you, when you are checking dilation, make sure it's an even light source. Okay. All right. So because if it is not an even light source and light is coming from one direction, it can alter the dilation of the eyes and freak you out a little bit. So make sure it's even light. Okay. Any discharge here, I'm going to make sure that I note, because I have found everything from open wounds to minor irritation here. Okay, making sure there's no discharge. And here is the one thing that the only thing you check for, you are so far ahead of the game, and that is gum color. Okay, I'm going to lift his gums up and I'm going to check his gum colors. And I know the camera here is not the best, but he's got nice pink gums. Okay, so what does gum color mean? Anything other, anything other than healthy pink gums is a reason not to groom this pet. All right, red gums. All right, this pet is in the beginning stages of heat stroke. Haven't done anything in your facility, and this dog is already having heat stroke. All right, if you continue to groom this pet, you're going to need to keep a really close eye on him, because this is the pet that's already starting heat stroke. Okay, pale gums. All right, pale gums can be poor heart flow. This is a pet that's a candidate for a heart attack. So bingo. All right, I will guarantee you, if I were able to go back in time, Bingo's gums were pale. Okay, and even if they didn't start out pale, they went pale. And as a groomer who specialized in senior pets, okay, I would check gum color throughout the groom. Okay, yellow is jaundice. This is a pet that's in liver failure. You could also check jaundice by looking at the whites of the eyes. If they're yellow, this pet should have been at the vet months ago. Okay, and then there's bluish gray, which is hypoxic. Okay, there's like no cells are not getting enough oxygen. So that can be old age. Okay, it can also be collapsed trachea. And when I mean old age, there's not much longer for this pet. But a collapsed trachea, especially the smaller dogs, okay? Those gums will present as bluish gray. And for dogs, the small dogs, Malteses, Yorkies, any breed, Chihuahuas, any breeds of pet that is prone to collapsed trachea, I'm checking gums throughout the groom. It is the single thing that could tell you whether or not you should be grooming this pet or not. My personal policies is that I would, if I get to somebody's home as a mobile groomer, pulling down their driveway, my normal policy is if I pull down your driveway, minimum charges apply, which is my hourly rate. However, if I get to somebody's house and this pet is not healthy enough to groom, I would much rather take the hit on income than deal with a social media backlash because a pet in my care experienced either a severe medical event or died on me. Okay. Or have their friends then trash my business. I don't want to do that. I'm going to say, let's reschedule. And I did that with a Maltese who was fairly new to my schedule, because I get to their house and they had two Malteses, and the male, the gums were, or the female, I'm sorry, the gums were blue and tongue was blue. So told this emergency situation, you need to go to the vet. I'll groom the other pet while you go. And she went to the vet. By the time she got there, gum color went back to normal. And this is how quickly this can happen, by the way, and how quickly things can change. Go back home. I can't groom the pet today. I'll come back in a couple of days. She calls me up the morning of the appointment. The gums are again blue and the tongue is blue. She goes back to the vet. It's fine. By the time she gets there, vet just sends her home, and that dog died 2 days later. That dog was a candidate that could have died on my table had I continued with the groom. And for those dogs that are prone to collapsed trachea, they make a lot of great products out there. So I'm just going to do a quick plug for the Trach Saver for groomers. It is a wonderful tool. I really wish that was available when I was grooming, but it was not. However, all right, it was something you can't loop. You can't put a loop around those pets' necks. But anyway, continuing on with the assessment, okay? While I am looking at the gums, I'm also checking the teeth, okay? The reason small dogs can be so problematic around their face is because they're prone to dental problems. All right. And how I would phrase this to owners, all right, whenever I'm telling an owner why I can't do something on their pet, I flip the script on it in a manner that they understand, because I'm putting it into terms that they can understand. So I'll ask them if they've ever had a toothache. All right. And most people will say, yeah, now you've had a toothache. Can you imagine brushing that tooth with that electric toothbrush while that you're in pain? And they're like, oh no, that would hurt. Yeah, that would hurt. I think a lot of times there is a disconnect between the teeth in a pet and the fact that it hurts them. All right. And who knows that it hurts? They know it hurts. Okay. So they're going to anticipate anything around their face, that clipper around the face, the scissor around the face. It's going to make it difficult to groom this pet around the face. That needs to be documented and noted. Okay. I may need a second pair of hands. I'm going to make sure they sign that you understand that due to the pain that this pet is experiencing in his mouth, this face is not going to look very good. Okay. All right. So to continue on, I'm going to come down here. I'm going to feel underneath the belly. All right. Now, if this is hard and distended in here, that can be bloat. Bloat is an emergency situation. And the only thing you could do for a pet that is bloating is to get them to the vet ASAP. There is nothing you could do as either a pet owner or a pet professional to help this pet. That is an emergency vet treatment. I'm going to feel around the mammary glands. And this is really important around cats. Even though cancer is more rare, less common in cats than it is in dogs. It moves faster in cats than it is in dogs. And where cats are prone to any kind of tumors is in the mammary glands. So I'm going to feel in here any lumps. I'm going to make sure that that this pet goes to I'm going to recommend that this pet goes to the vet. Okay. I'm going to come down the legs. And in this area, right in here, you can see, if I feel anything, any lumps in here, these could be ganglion cysts. Again, a nothing burger, if it is brought to a vet's attention immediately, if left there without treatment, this pet can then end up losing a leg. So I take any lumps in this area very serious to make sure that the owners go to the vet, get that checked out. I'm going to feel in the pads for anything. Now, on my dogs, I might do range of motion, okay? Meaning I'm going to move the leg in the manner of which it is supposed to move. I am not going to move it in a way that's not natural for them, all right? Clients' dogs, I don't necessarily do that because I don't want to cause, if this pet is arthritic, I don't want to cause a problem for them. My pets, I need to know when arthritis starts, okay? And Pooh here is already 9 years old, so we're not going to manipulate his legs. I'm going to come down. I'm going to do the same thing with this leg. I'm going to feel, and I'm going to feel in the pads. And I'm going to do the same thing to this side, okay? So I'm going to come down the leg, feel in this area right in here, check the pads, come around the back end, and feel the same thing too, okay? I'm going to run my hands down. I'm going to move my hands down, tail, and then I'm going to check out by taking a quick peek at his butt. All right. Sometimes he's done. We put him down. There you go. All right. Round of applause for Pooh. He was a good boy. So anyway. All right. Sometimes there are two little pimples on either side of the anus. They can be anal cysts, needs to be addressed at the vet. At some point, they will pop. They're messy and disgusting. Yeah, Angela, he is really sweet. He's such a good boy. So he's going to hit me up for treats by the handful when this is all over with. But when you are, the first time you do this, All right, back to the sis. Not a reason not to groom this pet. It's a reason to note it. Let the owners know. Again, I write things down on paper. All right. Barkley has cards you can buy. I can send Alex. He could post it in his group. I could do another form from Pet Tech. I just will say this. You can add your information to this form. You put your logo on it, but you have to leave Pet Tech's logo there. So I'm sure Alex will remind me to make sure I get that form over to him to upload to the group. I document everything, give it to the owners. I find most owners appreciate it. And it's something they could physically hand to the vet. All right. Rather than playing that whole, well, my groomer said this. Okay. That 5 minutes you spend with a new owner is so worth it. Now, once there's a baseline, once I understand, I'm not putting Pooh back up on the table anymore. Once I know a pet, a snout to tail assessment will take you less than a minute. And I would do it once upon greeting. Again, I'm always watching the pet. I'm looking for that discharge. Okay. If I get to when I get to somebody's house and the pet just doesn't look good, I'm just going to flip those gums real quick. And that's going to tell me a lot. But snout to tail assessment for an established pet. I mean, you can time this to see how long it is. Oh, Fluffy, it's been a whole 6 weeks since I've seen. Oh, I missed you. You were such a good boy. Okay. Literally takes 20 seconds just to run your hands over that pet's body so you know what you're dealing with and just check that gum color. Okay, hold on, chat. We got questions. Okay. Yes, Angela, I will make sure that Alex gets it. Okay. So I am open for questions on this. Okay. And I just really want to reiterate, I have never lost a client because somebody was annoyed by this. I have never lost a client because I put my policies and procedures and I followed them. And here's the thing with policies and procedures, your business, your rules, it's the way things are. Can you imagine going into, let's say, your doctor's office, all right? And you tell them, well, no, this is the way you're going to do this exam, and then hear what they have to say. No, it doesn't work that way. Clients should not dictate how we run our businesses. And I know that can be a little bit of a mind shift because we are so used, especially in a woman-based industry, to be people-pleasing and nurturing. And you know what? If I don't care for this pet, the owners are not doing a good job, I have to do it. You have to switch that mind shift. Okay. So if Alex wants to open up the mics and just simply ask questions, we could do that as well too. Okay, would you recommend calling the client during the groom if you find a blister or sore area? What would qualify as something not to worry about? Okay, so yes, sometimes you miss things on check-in. Okay, one time I did not notice the dog had ringworm after he was all wet because he was a big hairy mess. Okay. I am a huge believer in documenting when I see things. Okay. So let's just say I'm removing the matting on a pet. All right. And as I'm removing the matting, there's sores underneath it. I'm documenting that process. Okay. And I did this when I worked in corporate. Back in the day, when in order to document, mean they had the Polaroid camera out. Okay. So it's so much easier today on our phones. Okay. You can buy flexible tripod from Amazon. They're like $25. And you can video yourself as you're finding things. Take photographs. All right. I created a Google Drive. And in my Google Drive, I had the names of all my clients in there. Okay. and I put the Google Drive app on my phone so that any pictures or videos that I took during the groom, I could just move them from my phone right into their Google Drive. So I would have it, and then I could delete it off the phone because, you know, videos and such take up a lot of room, but the owners would be notified. All right. I would send them via text if I could, because sometimes videos can be a little data heavy, or I would send them a link from Google Drive to view the thing so that they knew. If it was something that required me to stop, meaning it was something open, all right? If it's open, the groom is over. If it's irritated or stuff, the groom may continue. But again, keeping in mind, I'm wavering people up the wazoo so that the owners are fully aware of what is happening, so it does not come back to bite me in the butt. Okay, so the other part of it, what would qualify as something not to worry about? All right, what's not to worry about? Here's the thing. You're gonna have to use personal judgment on here, but I could tell you what might not worry to me, okay? Warts and stuff that I nick, okay? It might not be a reason to stop the groom, but anything that is injured gets documented. So, did that answer your question? Yes, okay. I don't know if Alex wants to open up mics and people could ask questions.
Yeah, Mary, I had one come in to me on a DM. Was curious what happens. I think you started to talk about it towards the end of that question. What happens if you do have an accident? On the far side, maybe it is put, you know, in a scenario like you found yourself in with a dog that's dead on your table, but maybe on the lighter side, maybe a dog that has a reaction because of the ringworm or something like that, right, on your table. So what do you do in a situation like that?
Okay, so any injury that happens, first of all, owners are notified. All right, it doesn't matter how minor the injury is, owners are always notified. My recommendation, first of all, is to have the knowledge to deal with minor injuries. Okay, minor injuries meaning bleeding injuries. Okay, mostly bleeding injuries. All right, hands-on class. So not something you're sitting in a seminar room, not something you're watching online. A hands-on program, and the reason for that is that when you do things hands-on, all right, you're using your hands, it builds muscle memory. Right, I'm shaking the table. It builds muscle memory. And what muscle memory is that when something happens, your brain you don't have to think about what it is you do because your brain is already knows what to do because of that muscle memory. Think about driving a car, okay? That's all muscle memory. Riding a bike, that's all muscle memory. That's what muscle memory does. It's why first responders practice over and over again. It's for that muscle memory. So first of all, know how to deal with minor bleeding injuries, okay? Again, document the process, right? After you have an injury, all right, you need to debrief. You need to understand what happened, why it happened, what you could have done to prevent it next time. Those are all very, very important questions, okay? If it's something like a heart attack, like Bingo had a heart attack and literally died on my table, okay? Again, I had taken a pet first aid class like 6 years prior, but in that 6 years, since I never practiced the skills or took another class, I couldn't initially remember my CPR skills. And we could fast forward many, many, many years to the crew of dogs before this, in which my own personal dog had a heart attack. And my initial reaction was to panic. But the second I put my hand on my dog, I knew what to do. Okay. Know what's in your scope and what's not in your scope. Okay. If you have an accident, all right, I'm going to tell you the first thing you could do is you could take a deep breath, right? You take that deep breath because what happens is when you're in a panic, your body is flooded with Endorphins like adrenaline. Adrenaline is responsible for fight, flight, or freeze. Okay. So it cuts off oxygen to your brain. So you're reacting to a situation rather than acting. Okay. Movement dissipates adrenaline. Also, taking a deep breath forces oxygen back up to your brain. All right. So extremes. I've had minor injuries. I have, let's see. Oh, yeah. I tipped the very, very tip of a golden retriever's tail. Okay. That was dealt with an H bandage on the tip of the tail. And he went to the vet because that needed to be glued because he was a very happy boy and he just wagged his tail. And when he hit it against something, it would start to bleed again. That is still, even though it was a minor injury, that still needed veterinarian intervention there too. Okay. Tipping ears. Okay. I took the ding on my groomer test because I had a schnauzer and I needed to go up the ear leather with a 40, and I was not doing that because I had been there, done that, and nicked the ear. So I took the ding on that one. Okay. Ears can be a lot of minor injuries. All right. With nicking, especially the ear leather, hematomas can bleed. They look terrible. All right. A hematoma may also need veterinarian intervention, even though the event is usually once it bleeds out, it's done, but hematomas can fill back up again. So again, vet intervention there. Am I answering the question? I guess is what I'm trying to find out.
No, I mean, I think you answered it well. One question that I had as you were talking there is, where do you personally draw the line or advise people draw the line between groomer and veterinarian? I know some
Oh,
people draw the line at very different
okay.
points.
No, 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 no. That is a very solid line between a veterinarian and a groomer. It is not dotted. It is not gray. It is solid. Okay, so let's say what solid is. Performing any kind of veterinarian procedure. So in most states, using surgical glue, okay, is performing a veterinarian procedure. And I will tell you in the state of Massachusetts, that's actually a felony. All right. Other states, it might be a misdemeanor. Oh, you know what? Every state is going to be different. But surgical glue, and please, if you have surgical glue, and I have surgical glue in my pet first aid kit, okay? My vet has showed me the proper way of using it. And I would only use it on my own personal pets. I would never use anything that is considered practicing veterinarian medicine on a client's pet, unless I have a vet on the phone and he's walking me through it, because now I am under veterinarian supervision. And that's where the difference lies. Okay. And please do not use crazy glue or super glue. They do not contain medically safe ingredients. In fact, they contain medically unsafe ingredients. And glues used incorrectly anyway can seal in bacteria. You can cause a whole host of problems. Okay. I don't diagnose. So I would not say to somebody, your dog's ear is infected, because that's a diagnosis. I would say the ear is black and gooky, smells terrible, and write that down for them and hand it to the vet, for them to hand it to the vet. And I would put my phone number on it if the vet wants to call me. Right? Did that answer that question?
Yeah, no, that was great.
Okay. And dealing with minor bleeding injuries is not practicing veterinarian medicine. Okay. It's wrapping up an injury. It's doing first aid, getting it to the vet for the vet to deal with. All right. What steps over that line is using surgical glues.
Awesome. Well, Mary, as we wrap up here, where can people find you to learn more about this or to even join the community?
All right. You could find me. I am not fussy with my friends on Facebook. Okay. You want to send me a friend request, do so. Unless you're a retired surgeon, retired army general, you know, the doctor surgeons, a Nigerian prince, or the retired general. Okay. I'm going to accept your friend request. Okay. I wonder if guys have the same thing. Alex, do you get friend requests from like Nigerian princesses?
Yeah, but they flip them. Yeah, you're dead on. They're princesses. I'll get a lot of, daughters in need that, hey, my family left me. Can you help out? All the same stops, Mary, just a different look.
Okay, so yeah, I have a group on Facebook called Pet Groomer Town Hall. You could join that. Sending me a message on Facebook is probably the easiest way to get a hold of me. I am on all the social medias. I'm on YouTube. I'm on Instagram. Yeah, I'm on the TikTok.
Also,
Don't ask me how I've got any followers on that. I honestly don't know, but I do. So yeah, I am easy to find. You have questions. So again, either tag me in a group. If you have to tag me, otherwise I probably will not see it. Even in my own group, Pet Groomer Town Hall, tag me. Okay. If you have any questions, I am more than willing to answer any questions that you have, or you could find me at trade shows. Okay. Upcoming trade shows, I will be at the Tacoma show. I will be at the Rocky Mountain show. And thank you, Drake. He spelled it right. Pawsiteveed.com and a link. I appreciate that. I have, hold on a second, where else? I will probably be at Fitz in Florida. And maybe at the IS at Pet Pro Classic. That's a maybe for this year. Oh, and Super Zoo. You'll find me at Super Zoo. Okay. However,
awesome.
Super Zoo, I am swamped. I do 3 pet first aid classes. And if you want to take a hands-on classes and you're going to be at Vegas, I'm going to tell you to sign up for those classes quickly. They sell out. It is the one class I never promote that I'm at a trade show because there's no need. They fill up, they sell out. So if you want to take that class, let me know. If you are looking for a pet first aid class in your area and you're having trouble, send me a message. I will find somebody in your area for you.
That's fantastic. And Mary, what I'll do as well is I'll put the Pawsiteveed link in our community, as well as when you pass forward those check-in cards, that way we can parlay that over to everybody.
Okay, Angela, I never do. Okay, I walk in a little bit back. The only online first aid that I do is that in the mastermind library for Pawsiteveed, I do have a recorded bleeding injuries. So I will demonstrate bleeding online, and that is about it. Take a hands-on class. Okay. All right. Any more questions?
All right. Mary,
Oh,
you're amazing. Thank you so much for coming on.
all right. Thank you for having me. Oh, wait. 2 podcasts. 2 podcasts. Women Petpreneurs. And Alex, I want to get you and Shannon up for an interview on women petpreneurs.
You got it. I owe you that, Mary.
Set that up, the traveling groomers, and I would be totally remiss if I did not show you this.
While Mary's grabbing that, everybody, I will put the YouTube recording link of this in the chat just in case you want to go back and rewatch anything. Mary, what you got there? Is that one of your books?
This is my book, A Spirited Life. This is told from
Awesome.
Spirit's perspective. Okay. You can find it on my website. You can find it on Amazon. It's a great book. Buy the book. I got to at least break even on it.
Fantastic. All right, Mary. Well, thanks again for coming.
Right.
We'll put the recording in the chat.
All right. And I will send that document, the check-in form to you via Facebook Messenger.
That'd be great. And I'll pass that on.
All right.
All right. Thanks for coming, everybody.